Hi, Dr. Roll. How are you?
How are you
I'm
doing?
doing great. It's so great to meet you. I'm so glad we're having this
Oh,
conversation today.
thank you so much for having me on your platform. All of us prep lovers, appreciate it.
Exactly, I know. And I'm really excited about this topic. And I think anyone that's here that follows me already knows that. I'm Caleb Gossip for anyone that doesn't know me. I've been working on a variety of HIV initiatives for the last 10 years, still working professionally there as well. And just to confirm, I use he, him pronouns for anyone that may not know. And the focus of our brief conversation today is going to be the current HIV PrEP options, the importance of testing, potential side effects, which is a very there's a big interest in that one from my followers, as well as PrEP's role in HIV prevention and your sexual health. So before I hand it over you to Dr. Roll, I'd love for you to introduce yourself to everyone. I have a quick disclaimer. This session was developed by Vindico Medical Education and the American Academy of HIV Medicine with the help from an educational grant from Gilead Sciences. More information can be viewed in the link, and I'm going to put that in a comment here now. So I'll hand it over you to Dr. Roll so you can introduce yourself as well.
Thank you so much, Caleb. My name is Charlotte Roll. I'm an adult infectious disease physician, and I'm the research director at the Orlando Immunology Center in Orlando, Florida. It's so great to be with all of you guys this evening.
Yes, thank you so much. Like I said, I'm really excited to have this conversation. So, how this is going to work is we do have some questions that I've lined up for you, and we'll go through those. But anyone that's on, if you would like to ask some additional questions, there's a question mark little chat bubble at the bottom. Please use that and add any additional questions that you may have, and we'll try to get to those before our time is up. So, we'll just go ahead and jump in. The first one here is what PrEP options are currently available? Because I'm assuming many of my followers are familiar with one of them.
I love that. So let's get into that,
Yeah.
Caleb. Currently, three prep options
Okay.
available, so not just one. So
Okay.
hopefully everyone who is on this live. We have two oral prep options. You guys may be familiar with them. Truvada
Yeah.
been approved since 2012. Caleb, can you believe PrEP's 12 years old?
I know. And still, we have so much work to do. It's crazy.
2012. So for 7 years, we only had Truvada. In 2019, Descovy entered the market, and it sounds like we're going to be talking about some key differences between those two options
Yeah.
later. And then lastly, at the end of 2021, for those of you guys who hate taking daily oral pills but are really interested in being on PrEP anyway, we have a long-acting option. It is called Apretude, and it is an intramuscular injection given every 2 months. So those are our three options, Caleb.
Yeah. Wonderful. And thank you. And I will say I'm on Descovy. I've been on Descovy for 2 years now, and it's going great. And I know we're going to talk about side effects here in a bit, but I do want to get into something that I hear often is like, well, what's the benefit of like Truvada versus Descovy or now Apretude? Like, how do I choose which one that I want? Do you have any insight on that?
Yeah, I think that when we were all doing the research around Aptitude, right, that was an option that really was sort of driven by the fact that people want options, Caleb. Like, not everyone can commit to a daily oral pill. Kudos to you for doing so the last 2 years.
Thank you.
That's amazing. But
It works.
right, we have like so much like qualitative data, and we've done so much surveys in different populations that show that people just want options. It's really hard for people to take a daily pill for something that they have.
Hmm.
It's really hard for people to take a daily pill for something that they don't have,
Exactly.
It was very challenging for some people, and especially cisgender women, and then super young adults, right? The adolescent trials of PrEP, they were a little bit heartbreaking for all of us because the adherence was terrible. And so
Oh,
we developed Aptitude that was really for them, right? That was really
got
for
it.
populations that are challenged by daily or oral adherence. And so we have three great options on the market. They're all amazingly effective at preventing HIV. And now people get to decide like which one is right for them. And I think that that's amazing.
Right, that is awesome. I mean, it's not always one size fits all, and just adding more options to our prevention toolkit, if you will, is awesome. Because I think my vision is providing someone with a menu of options when they're interested in PrEP and going to the clinic. So I hope we'll continue to see more options come around in the near future. Um, so can you discuss the importance of regular testing and follow-ups with a provider when someone has started PrEP?
Absolutely, and it sort of goes back to the question of side effects. So let me just run through that sort of really quickly. Truvada versus Descovy.
Hmm.
We're talking about potential differences in renal and bone health.
Okay.
But Kayla, truthfully, like, Truvada's been around forever. It's a drug with like really long safety profile. And when we think about PrEP and who's taking PrEP, these are often young, healthy people with very few medical problems, right? And so even though we're seeing numerical differences, perhaps really small, might I say,
Hmm.
numerical differences in some renal and bone parameters, you always have to ask yourself, like, does that translate into clinical outcomes,
Yeah.
right? PrEP population, it really doesn't. And so a lot of us who prescribe these drugs, we're just like, listen, if your insurance prefers you to be on Truvada, unfortunately is generic now, so a lot of
Yeah.
insurance does prefer that, you should go on Truvada, okay? Like, don't worry about it.
Yeah.
If your insurance allows you to get Descovy, amazing. Let's do Descovy, okay? And so that's really what it's coming down to. Now, Apretude, which is that injectable I told you about, biggest side effect, injection site reaction, a little bit of discomfort, maybe a little bit of swelling. Right around the time you get the injection. Doesn't last very long though, Caleb. And as people get more and more injections, they'll tell you they get used to it. They learn how to deal with it, and they come in at their fourth injection and they're prepared, and it doesn't phase them
Yeah.
out.
That's wonderful. And so, what I'm hearing is that the importance of doing those testing and those follow-ups is seeing a provider regularly so that if you do end up having side effects that may be a little more intense than ones that typically go away, then you can see your provider more frequently and talk about that and see if there's another option that may work better for you since we have choices now.
Absolutely, Caleb. When you choose something, you don't have to stick to it. Like, that's just like anything else in medicine, right? Choosing one up front means you can switch to one later if you think that that's right for you, or like you said, if you're having what we consider to be intolerable side effects.
Mhm.
The other reason we have people come in is PrEP is for people who currently not living with HIV. The whole
Right.
keep that way, right? So we gotta keep doing regular HIV testing to ensure that you have indeed remained HIV uninfected whilst you're on PrEP. Because hey, Caleb, even though a lot of people think that people who are taking PrEP must have HIV, that's not true, right?
Right.
So the reason that that's just would be a tragedy is because PrEP is not sufficient treatment for HIV. HIV requires combination therapy.
Exactly.
PrEP is just one of the drugs in that combination. And so we have to make sure that people on PrEP are indeed staying HIV negative, just because, God forbid, should you acquire HIV, whilst on PrEP, we need to switch you immediately to something that would be considered adequate for treatment.
Yeah, absolutely. And thank you for saying that because I know in my time in HIV, if people are familiar with some of the drugs and they hear Truvada or Descovy, which are typically used in combination, they're like, wait, that's a treatment. And I'm like, no, by itself, it can be used as prevention. So, and I think even some providers need to be educated on that as well because they're very familiar with treatment, but maybe not the PrEP use. So, thank you for that. Um, and you already sort of covered the side effects that could potentially happen. But one clarifying thing I think for everyone, because you talked about maybe a reason to use Apretude is because you're not able to adhere to a daily pill. Could you confirm? And I don't know if you'd already said it. How often the shots happen with
Yeah,
Apretude?
so they're every 2 months. You get a whole 2 month break. I must tell folks that Apretude does have to be administered by the healthcare provider, though. So that's one thing
Yes.
to account, right?
Yeah.
Do you really go in 6 times a year?
Right.
So that's one question that folks who are interested in Apretude have to ask themselves. But it is every 2 month shot.
Yes, awesome. Thank you. And I mean, that's sort of the pros and cons, it's really weighing your options. And so that's good. Um, and then, so as far as like the questions that I had, I have one more, and then maybe we can jump into some from people who are online. How does PrEP fit into the broader strategy of HIV prevention as well as overall sexual health in the
You
community?
know, Caleb, that's probably one of the more important questions I think that
Right.
on tonight. PrEP is really, I think you said it, the HIV prevention toolkit, right? It is an effective, tried and true, tool that we have. And it's actually a really important part of the ending the HIV epidemic, which is the
Yeah.
federal to reduce infections by a certain amount by 2025 and actually by 90% by 2030. And
Yeah.
all of us who think of the HIV prevention continuum acknowledge PrEP as a key part of that. Starting off with people who are not infected but are exposed, which is where PrEP jumps in, all the way down the line to people who are living with HIV who achieve an undetectable viral load with their therapy and are therefore untransmittable, right? That is a biologically
Hmm.
proven fact, Caleb. U equals U.
Yes. U equals
Equals
you. Yes. I love to hear it.
absolutely. And so, PrEP is on the other side of that continuum, but it still is a continuum. And each part of it is important and critical to preventing new HIV infections. And so it really is, in my opinion, there's like four key pillars, and PrEP is like, I think, pillar number either one or two of the right. And so it is important for community health, it's important for population health, and it's important for individual health. It gives people a sense of control over their own sexual health and allows them to live the way they want and live the type of life that they want and not live in fear of doing that. I think it's so important.
Yeah, absolutely. And thank you so much. I'm really happy to hear you bring up U equals U and sort of the part that people who already have HIV can play in this ending the epidemic and in prevention itself. Because I think a lot of times people forget about that, is that you still have a part in avoiding and preventing new infections. So that's amazing. Thank you. We do have a couple minutes, so I am going to look at the questions that were submitted. Um, Oh, and this is one I've heard before. So, how quickly does PrEP become effective once you've started taking it? Or how long does it take to become effective?
That's a good question, Caleb. So we think that for men, all right, it takes about 7 days to reach protective concentrations, in the rectal and penile tissues. For women, though, when we're talking about the cervical vaginal tissues, we think on average it takes 21 days
Okay.
to achieve a therapeutic concentration. So that's an important gender difference, right? That we actually will counsel people on when we're sitting in front of them in the office. Now that is, I'm talking about that for oral PrEP, Caleb. In
Yes.
PrEP, we actually don't have that data
Because it's
yet.
so
we don't,
new.
it's so new.
Got it.
Don't have that time to effectiveness data for injectable PrEP yet. So stay tuned. Like we're working on it because it's a very
Yes.
keep getting axed. So we got to figure it
Yes. When we'll be sure, I'm sure it's all of us to share that information as soon as it comes out and distribute it to everyone so that they can get those updates. So we'll be waiting. Unfortunately, our time has come to an end. It was very quick, and I'm sure a lot of people have questions. So be sure to follow me as well as Dr. Roll. Like I said, we'll probably be both sharing information as it arises for this topic as it becomes available. But the conversation isn't going to end here. Dr. Roll is going to be talking with Christopher Rivas about the HIV PrEP misconceptions and myths, which I think a lot of people are going to be interested in. So please look out for that here in the next few moments. Also, if you go to the link in my bio, you can complete a quick survey about the attitudes towards PrEP, and you'll have the chance to win a $100 Visa gift card. So feel free to go over there now if you'd like to. But Dr. Roll, again, thank you so much for this. This is amazing. And like I said, I'm very passionate about this work, obviously. And so it's always amazing to have this opportunity to talk with someone who's just as passionate.
Thank you so much, Caleb. Good night, everyone.
Yes. Bye, everyone. Thank you.